115 people die from an opioid-related overdose every single day in the United States. The opiate epidemic is one of the most prevalent and devastating issues our country faces today. I have personal experience with opiate addiction, and I want to shed light on this disease and bring awareness to others. I will be explaining what an opioid and an opiate is, tell about how this issue is affecting our country as a whole, and share recent statistics from the Minnesota Department of Health, specifically about the overdose rates in Minnesota. For those who don't know, there is a subtle but significant difference between an opiate and an opioid. An opiate is a drug naturally derived from the opium poppy plant. Examples include heroin, morphine, and codeine. Opioids is a broader term which includes opiates, but also refers to any substance that binds to the brain's opioid receptors. The opioid receptors are responsible for controlling pain, reward, and addictive behaviors. Examples of opioids include Vicodin, Percocet, Oxycontin, and fentanyl. Most often, opioids are obtained legally by a prescription from a doctor, but they are often misused due to the euphoric effect and can very easily become addictive. According to the National Institute on Drug Abuse, 21 to 29% of patients who were prescribed opioids for pain become addicted. Furthermore, 80% of people who use heroin first misuse prescription opioids. Last October, the opiate epidemic was declared a public health emergency by the United States government. From 2001 to 2017, opioids have cost this country over $1 trillion in the cost of healthcare, loss of productivity, addiction treatment, and criminal justice involvement. The U.S. Department of Health and Human Services is currently focusing on new ways to address the opioid crisis. They are looking to improve access to treatment, providing support for cutting-edge research on pain and addiction, and promoting the use of overdose-reversing drugs. As I said in the beginning, 115 people die every single day from an overdose in this country. I wanted to find statistics which were specific to our home state of Minnesota. According to the Minnesota Department of Health, overdose deaths have increased by 18% from 2015 to 2016. This graph gives a visual to these numbers. As you can see, overdose deaths are increasing year by year, with the most recent year of 2016 showing 396 people in Minnesota who died from an overdose. During my struggle with opiate addiction, I overdosed twice and am grateful to still be alive. I've found freedom and recovery from this disease, but there are 115 people every single day in this country who don't get that second chance.